My name is Dr. Cassius Camden Clay. Most people call me Cam. I've been in practice for 34 years as a chiropractor. I was first introduced to Thai massage in 1991 by my friend Nicolette Vike. Later, I had the great opportunity to study with Chayut, and his last name is spelled Priyassith, in Chiang Mai, Thailand, beginning in 1997, once for a month each year for 4 years, studying privately. I also studied with my friend Pachet Buntong in Hang Dong, Thailand, beginning in 1998, for a month each year for 3 years. Chayut and Pachet, back in the day, were the most recognized and most influential Thai massage masters. I have taught over 280 6-hour Thai massage workshops, primarily at the Atlanta School of Massage. It began as a 20-posture 1-day class and evolved into a 100-posture 5-day class. I continued developing, cutting postures I didn't use, cutting redundant postures down to 80, 60, 40, and then to my present course, which you're getting here, 20 postures taught in a 12-hour 2-day workshop. One course is taught on the massage table for massage therapists. The other course is taught on the Thai floor mat on the floor for yoga teachers and fitness trainers. The routines I have choreographed are impeccable. I rarely use any postures which are not in these routines which I am presenting to you at this present moment. This is probably going to be the best bodywork course you have ever taken. It's so useful and people feel so much better. It immediately improves their function. It's awesome. And in my opinion, I am the best instructor of assisted stretching. This introduction is the same for the assisted yoga postures on the table and the assisted yoga postures on the floor mat. In my 30s, 40s, and 50s, I practiced exclusively on the floor mat and I loved it. And I recommended people not use the table, do it on the floor. The massage therapist did it on the table. In my mid-50s, after a busy day crawling around on the floor, my knees ached and I didn't like that. And I started teaching both table and floor postures at the same time. I found for certain that practicing on the table is better ergonomics for me and less work intensive for me. Yet working on the floor provides us with more opportunities. Yet, I promise you, any outcome I seek stretching people, I can accomplish it as well on the table as on the floor. If you're younger and you're in great shape and you want to practice on the floor, have at it, be my guest. It's awesome. And if you're having trouble with your knees and or you're obese or you're getting older, take it from me, practice on the table. In my rules, I'm number one, I come first. It looks like I'm here to take care of the client. Well, I am, yet I come first. I do not risk injuring myself to relieve someone else's discomfort. I've done that. I don't do it anymore. As far as I know, I have never injured anybody stretching them. And I know practitioners who have. This is not a game, this is serious, be careful. In the 1990s, a number of people went to Thailand and studied Thai massage and immediately began producing their videos and books. Most of these videos and books made in the 90s contain poor ergonomics for the practitioner and unsafe postures for the client. I have taken the time and the years to incubate this information. And proper ergonomics are so very important. In yoga, my yoga teachers teach me to elongate my spine. In Hapkido, my martial art of choice, we're taught to relax completely, not a slouch and relax, but an elongation relaxation, similar to Tai Chi people. Alexander created this technique called the Alexander technique, where he discusses having the head like a helium balloon floating up, and the spine falls like a string under it. Technically, the muscular system is tractioning your spine. Now that is proper ergonomics when practicing assisted yoga. In my classes, I walk around the room and I ask people, are you being a balloon head? And they say either they are or they are now. It's very important. It is a meditation on being present in our bodies and a meditation on our relationship with Mother Earth. In a hurried time at home, I'll be stomping around the house and my wife will say, "Beloved, walk softly on Mother Earth." And I say, "Thank you, beloved." People who practice yoga have learned how to stretch themselves, and they have good elongation and good ergonomics, and immediately seem competent at practicing Thai massage. They know how to stretch themselves. They have a better idea about how to stretch you. If you love practicing assisted yoga, I recommend that you study yoga. It's a good blend. When I practice yoga, I get flexible and strong. When I practice assisted yoga, I get strong and the client gets flexible. Older people do not stop playing their games because they got old. They stop playing because they got stiff and or they're in pain. Older people love being stretched. They will come back over and over. That generation learned cardiovascular fitness. They learned diet. They did not learn flexibility training. They missed it. The people in their 70s and 80s, they didn't get it. Yoga's pretty rigorous, and some of them just are not able to get into a functional yoga practice. So I become their assisted yoga class, sometimes once a week, sometimes every 3 weeks. Those people come in and they love the work. One gift I have for you is I am a musculoskeletal anatomist. My Thai massage teachers did not know what was under the skin. I have a huge advantage in proper posturing due to my knowledge of anatomy. I have been muscle testing for 38 years. In 1979 at Life Chiropractic College, I learned that the correct chiropractic adjustment made weak muscles found instantly strong, and I liked that. Several decades ago, I learned that any muscle found weak through muscle testing, I can make strong with an assisted stretch. That changed my concept of what chiropractic adjusting is. The standard chiropractic theory is an adjustment moves a hard bone off of a soft nerve. My theory is a chiropractic adjustment stretches connective tissue attached to that bone, thereby not only improving nerve conduction, also improving blood flow, lymphatic drainage, and cerebral spinal fluid flow. Our nerves, our blood vessels, our cerebral spinal fluid spaces, and our lymphatic spaces all course through and are supported by our connective tissue. This is a new paradigm. People commonly think when I muscle test them that, oh, the muscle's weak, I need exercise. That's their paradigm for how you fix a weak muscle. The new paradigm is we can make weak muscles instantly strong by creating space in just the right places. It's all about making space. Chiropractic and assisted stretching is a marriage made in heaven. That's why I got in this field. I found that when I stretch people first and then I adjust them, the adjustment goes so much gentler, so much softer, and the outcomes last longer and better. Coming up, I will be teaching you how to stretch a thick leather covering over the low back called the lumbar aponeurosis. It is the hub upon which our connective tissue tree exists. 6 years ago or so, I was treating a child. She was 16 years old. She had a double severe scoliosis, spinal curvature. She couldn't sleep. She was miserable. Through chiropractic adjusting, I straightened the top curve out. The bottom curve in her low back was not going to straighten out, and I'm stretching her lumbar aponeurosis, that thick leather covering. I'm explaining to her if she hangs upside down on the inverted track regularly, and if she doesn't do any long distance running, and if she doesn't do any heavy lifting, she can have a comfortable life with her distorted spine. And as I finished telling her I couldn't fix it, it was gone. And I went, how did that happen? And so I got on it and I researched it. One stretch posture I have for the low back, when the pressure is applied, as I shall describe to you, the scoliosis goes away in a matter of minutes, even if the people are older, even if people in their 60s, for a moderate to mild curvature that's functional. There's another posture for the thoracic spine that when applied with correct pressure, that also resolves in a matter of minutes. And certain stretching techniques which emulate our stretching, which are self-produced stretches, can maintain the spine free of scoliosis. This is important information. It's an awesome discovery. This is going to be huge for the people who become competent at scoliosis resolution. It's worth buckets of money. People with scoliosis, they're in constant spinal discomfort. Please study that chapter on your video and in your book. Barbara Sharp was one of my long-term students, and she wrote the first draft of the first 80 Thai massage postures for my courses. And then we got together on Wednesdays between 10 and 4 for 19 months and wrote 2 books entitled Targeted Muscle Testing and Quick Self Fixes. Targeted muscle testing are 31 muscle tests which chronically test weak. And quick self-fixes are self-treatments, self-stretches, and joint motions which we do to ourselves, which make these weak muscles strong and keep them strong. So thank you, Barbara Sharp. She helped me teach Thai massage off and on, and still does help me off and on. And she taught me that women practice assisted yoga different than men. I would show a posture one way, and she would show it a different way. So keep in mind, the postures you're learning here, the postures I'm presenting to you, are a concept for a stretch. It's important that you improvise, adapt, create, and invent. And if you aren't comfortable with the posture, abandon it. You are invited to go to my website, quickselffixes.com, and follow the links for a free 30-minute video and book on 5 muscle tests and 5 quick self fixes for the shoulder joint. You may just find it's something very useful for you in your practice. There are a few contraindications which are important. Number 1, for clients who have had surgeries of any kind, clear with their doctor that it is safe to stretch them. And in particular with joint replacements, be certain that you communicate with the doctor or physical therapist to be sure that what you are doing is safe. People commonly have disc herniations. A disc is a fluid-filled jelly roll, and the fibers run in concentric cartilaginous circles. Sometimes these fibers break and the center fluid portion shifts out of place, causing the disc to bulge onto a nerve. As it heals, the fluid-filled portion is back in place, the person's posture is well, and they're feeling good. And 1 in 5 people who have had a significant disc herniation relapse because they do something too soon and it re-tears. Study the chapter in your book on contraindications. In fact, read all of the print pages in the front of your book to have a complete introduction to this course. That is very important. My wife, Shawn Murray, is a board-certified osteopath in osteopathic manipulation and neuromusculoskeletal medicine. I am so thankful to my wife, Shawn Murray, for all of these 26 years that we have been together and her support and helping me to create this program. It's been quite a journey together. Now comes my lecture on No Pain, No Pain. This is written in your book on the chapter No Pain, No Pain. First we have be prepared. Be prepared means get to work well rested. I'm getting paid to be at work sober and focused. Stretching people demands a focus. I watch my blood sugar. I have a healthy breakfast and a healthy lunch. I may have some dessert at night. However, during the day, I have balanced blood sugar. Also, doing assisted yoga is physical labor, like working on the chain gang, buddy. It's physical, and if it's hard for you at start, that's okay. If you stay in it, you will eventually be sinewy strong. I love when big people come in and I get to treat them for 50 minutes. I'm getting paid, well paid, to go to the gym and work out. Awesome. Beats a desk job, huh? So, before I come to work, I do my quick self-fixes, which involves a series of stretches. I get to work stretched out. You wouldn't go to the gym and move heavy weights unless you had stretched out first, would you? I warm up. Next is go slowly. If I'm pin somebody's joint and pull it at the same time, I just doubled my speed. One train going that way, one train going that way. My style is pin and then stretch and hold and wait for the release. I walk in the room slow. I walk around patient slow. If you're moving fast, their subconscious mind is going to say, I shouldn't trust this person. So it's all slow. And I say, if anything hurts at all, say, lighten up or stop. Stretching people should never cause pain, except for, oh, wow, that hurts really good. Yay, keep doing that. Where have you been all my life? I love it. Stay there, great. No pain, though, no sharp shooting pain, nothing like that. Should never hurt me, never hurt the client. No pain, no pain. Rule number 3, I am number 1. It looks like I'm here for the client. Well, I am here for the client. I'm here for me. I do not trade and accept new pain in my body to relieve their pain. I don't do that. I've done it. Take it from me. Don't do it. You can't stay in this rigorous physical body work field if you're getting injured. You won't last. You got to take care of yourself first. You are number 1. Next rule, 4 of 6, look pretty. That means proper ergonomics. That means the Alexander technique, floating up, maintaining a yogic posture while at work, being quiet like the Tai Chi person who you never hear them walking on the floor. That's proper ergonomics. Also proper ergonomics are, in yoga we learn to pull our shoulders in. In CrossFit, people learn to pull their shoulders in prior to doing certain lifting exercises. If you're working with your shoulders out, at the end of your day, I promise you, you're going to be achy through here. I promise you, I've done it. I figured this out. Rule number 5, never trust anybody. If there's a floor posture and somebody moves their arm and you step on their hand, whose fault was that? My fault. I trusted them to not move. If I'm in a floor posture using somebody's weight to counterbalance my weight, if they move and I fall, whose fault is that? Mine. Never trust anybody. Rule number 6, just be nice. I had a phase of stretching people too hard. Colleagues of mine have that phase. When I teach, I say, for any student of mine in this class who practices this work diligently for 3 months, you can come to my office for 1 hour for free and treat me for free and bring me lunch. And people do that. It's a gift to me because I love getting this work, and it's a gift for them because it's one-on-one with me. The biggest complaint I have is people are working too hard. I'm not going to let go and relax completely because I'm afraid y'all might hurt me. So take it from me, just be nice. Skip that phase. So here goes. Have a great workshop. I'm so happy you're with me and studying assisted stretching. This is my friend Christy Winkler. Thank you for helping me, Christy.
My pleasure.
Yay. When stretching our clients, we give our weight, our strength, and sometimes it's just not enough force. Here comes a powerful tool for force. In the martial arts, it's called unliftable body. I don't understand how it works. I just know it works. My dog could do this thing. He was 85-pound, half lap, half pit. He could sink himself into the floor and I could not pick him up. Little children know this also. Christy, pretended you're 3 years old at the birthday party and the cake is coming out and the candles are lit and your dad says, we gotta go, but you don't want to go, so you're gonna flow your cheek through your fingers into the floor, let your knees bend a little bit, just flow and chant to yourself, hell no, I won't go. Got it? First of all though, let me lift you, okay? And relax, and here we go. Oh, I did it. And now flow your cheek, Christy. And here we go. I can't budge her. Try this with a friend or friends. It is fair to have one person on this arm and one person on the other arm. When doing this, do not lean them backwards or it's an invalid experiment. What you're checking for is, does the person feel like they have gained weight? Yes, you may be able to get them up, yet I promise you, when done correctly, it's stunning. Christy, please lay face up with your head there. Our connective tissue is one piece. You stretch it anywhere and you have a relaxation effect everywhere. Here's a little experiment for you. Touch the top bone in your spine with a finger on each side just below your ear. Close your eyes and now look to the left and look to the right. And notice that the top bone in your spine moves as you look to the left and look to the right. That's a sensation of our connective tissue is connected. Here is the calf stretch. I'm going to support Christy's lower leg on my thigh. Very important, I'm going to brace her big toe side of her foot on my forearm. If it's over on the little toe side, this stretch does not work. It's got to be on the big toe side. I'm going to cup her heel. Next, I'm going to place my thumb in the belly of her tibialis anterior, which is on the right-hand side of her tibia bone. I'm going to push in with my thumb and I'm going to grip her lower leg. Here's my pin. I'm going to lean towards Christy and I'm going to hold her leg and pull her leg towards her foot. That prevents the knee from being hyperextended. It may look like I'm pushing that way. I'm not pushing down, I'm pushing towards her foot. Got it? Do not do this stretch on people who have double jointed knees. Do not do this stretch on people who have artificial knees. Do not do this stretch at all if it causes any pain anywhere whatsoever. So, I'm on the big toe side of her foot. I'm cupping her heel, have a thumb in the anterior tibialis. I'm gripping her lower leg, pushing her lower leg towards her foot. I'm leaning towards her. That's the pin. Here comes the stretch. I turn and face her. I use my weight, my strength, and now I flow my chi. Once I'm comfortable and in position, I float my head upward. I'm a balloon head, and I'm exceptionally comfortable here. I wait for the release. And there it went. This is the calf and hamstring stretch, similar to the calf stretch. I'm bracing the big toe side of her foot on my forearm. I'm cupping her heel. I'm dorsiflexing her foot, pulling her big toe towards her nose. I now grip her quadricep muscle firmly and pull the meat toward the feet. I'm pulling that way. I'm not pushing that way. Pushing that way would be just wrong, hyperextending the knee. Do not do this stretch on hypermobile, double-jointed knees. Do not do this stretch on people with artificial knees. Do not cause any pain. I lean towards Christy. I now use my weight, my strength, and I flow my chi. Now I have a good stretch going on here. I breathe and I relax and I float upwards. Very comfortable. And I wait for the release, and it just happened. That was it. I moved a little bit. Did you see it? This is the medial hamstring stretch. I'm bringing Christy's knee to the same side shoulder, but out from the shoulder. I'm holding Christy's heel. I'm bracing the other leg on the quadricep muscle closer to the body. This is the pin. The actual stretch is partial extension of the lower leg, like an old-timey water pump. Here's my pin. Now, I'm going to lunge that way. I'm not pushing by pushing my hand that way. That would be poor ergonomics and working too hard. We want to work less and get paid more. I'm going to lunge. Here we go. There's a pin. Here's one pin. The second pin is bringing tension to her leg, and now here's the stretch. I'm going to lunge. I'm watching Christy's face for signs of discomfort. She knows to say lighten up or stop if there's any pain at all, right, Christy?
Right.
I elongate upwards, and I wait. And there goes the stretch. People are shorter, taller, bigger, smaller, have injuries, very flexible, not flexible at all. So it's important to remember to always be free to improvise, create, change it, adapt it, and if you can't find comfort for both people, abandon it. So let's say Christy was taller and more flexible. I might do this stretch with the arms straight and stretch. Commonly, I'll brace my elbow in my rib cage and stretch. Other times, I'll come in with her Achilles tendon on the back side of my shoulder and I'll lunge and stretch. The important part is comfort. Here is the lateral hamstring stretch. Our contact point is the ischial tuberosity. If I try doing the lateral hamstring stretch on this side, I just can't make the reach. If I was doing it on the floor, I could. However, this is table-assisted stretching. I'm going to stretch the opposite lateral hamstring. I'm going to brace on the ischial tuberosity, and I'm going to bring her thigh into full flexion toward the opposite shoulder. I'm now going to lunge to partially straighten the lower leg, just like the water pump. It's not a full straightening, it's a partial straightening. I could brace like this and lunge. If she was super tall, I could brace like that and lunge. For her body type and mine, I feel super comfortable with a shoulder contact, pinning the ischial tuberosity, bringing the thigh into full flexion toward the opposite shoulder, and now lunge. Now that I'm here, I float up, I relax, and I hang out and wait. It just let go and I move. Be watching for my movements. Here is the iliotibial band stretch. The iliotibial band begins where the tensor fasciae lata tendon inserts into it, comes all the way down and crosses the knee. It's an actual physical band. If you dissected it out, it would be like a rope, very strong. Off of the IT band, there's a thick leather fascia covering called the fascia lata on the outside of the leg. If you dissected the fascia lata and the IT band out, you could make it into a human drum. It's that intensely thick. Pressure on the IT band commonly causes pain. I want to lighten up before a person can even say the L in lighten. Here's an exercise for you. With a friend who doesn't mind experiencing some sudden sharp shooting, stabbing pain, contact the head of the soleus muscle, which is below the knee and about right there. You dig in there and buddy, it hurts. When that happens, there is a sympathetic response and the facial pallor goes a hue darker. Start with people who don't have beards, aren't wearing makeup, and have light skin, and work your way to darker skinned people. Even with people with exceptionally dark skin, you can see it if you train for it. It's there. Furthermore, if watching closely, when we elicit sharp, sudden stabbing, shooting pain, the pupils suddenly dilate, letting in more light to see the lions, tigers, and bears. I'm focused when I'm working on people. I'm watching their skin pallor. It's a huge help to me. Christy, do you mind if I cause you some sudden, sharp, shooting, stabbing pain?
I guess not.
Thank you. Okay, I'm coming in with the thumb on the head of the soleus. I'm watching her face, and there I go into it, and she just hewed. Boo. It happens just like that. If you look for it, it's there. So, with the IT band, I'm going to stretch 3 spots. I'm going to do the middle, and then I'm going to go a little lower, and then a little higher. It's kind of like this is a bowstring, and my thumb is the arrow. I'm going to start in the middle, and I am going to use my thumb here. I am going to brace her foot. I'm not going to hurt her foot. I'm just going to brace her foot. I'm going to hold her knee. I'm going to come in with a thumb, pin, stretch, and hold, and wait for the release. I'm going to go several inches closer to the knee, pin, stretch, and hold. I'm pushing that way. Wait for the release. I go above several inches, pin, stretch, and hold, and wait for the release. Here on this leg where you can see it, I'm pin, stretch, and hold. I pin, stretch, and hold. I pin, stretch, and hold. Now, if it's a bigger, thicker person, I'll use my knee. I'll hold their knee, I'll hold their hip joint, I'll come in with the knee, and I'll grab that IT band with my knee, and I'll pull it that way. On people smaller than me, I don't do this, but if I have somebody in that's super, super large, my thumb just doesn't do justice to their needs. IT bands are commonly exceptionally tight, and yoga really does not address tight IT bands well. When the IT band is tight, it makes tensor fasciae lata muscle go weak. Gluteus medius is in the same fascial plane as tensor fasciae lata. That goes weak. The IT band has a fascial bridge going over the gluteus maximus, inserting into the thoracolumbar sacral aponeurosis, making tension in the low back, which causes weakness in quadratus lumborum and multifidus. I promise you, if you test those muscles and you find any of them weak, and you do the IT band stretch, it's going to get strong. For my quick self-fix that comes from this knowledge, I pound the fascia lata and the IT band on myself just like this. Same effect. Those muscles get strong. In your book, you have a chapter on palpating the sacral rhythm prior to doing the adductor stretch. The adductor stretch is next. So here's palpating sacral rhythm. This is one more useful tool for me to know if my treatment was successful. The adductors, tie the femur to the pubic symphysis right here. Ties the femur to the pubic symphysis right there. When the adductors are tight, they put pressure pulling the pelvis in tight, and the sacrum can't move as it should. Cranial osteopaths focus on the cranial sacral rhythm. I learned this from my wife. The sacrum should be moving 6 to 8 cycles per minute. If it's not moving correctly, it pants. It goes trying to breathe. It should be moving in, pause. Pendulum swings out. When it's stuck, it's got it? When it is stuck, it's not pumping cerebral spinal fluid up the spinal cord around the brain. The cerebral spinal fluid carries oxygen and glucose to the brain, causing CRS, which stands for can't remember stuff. Lay face up, please. In our chair-sitting culture, people have excessively tight adductors to the point that in our 50s we can't just let our legs down. They stay up in the knees stay up in the air. It's a chronic problem. Cultures that don't have chairs, they squat, and I'm sure that their adductors are nice and loose. This is a very important stretch. I place Christy's arch of her foot on my anterior superior iliac spine right there. I have 3 pins here. I pin the adductor longus on the leg that's being stretched. I pin the adductor longus on the other leg. That's 2 pins, and the third pin is I push her leg that way with my hip. So pin 1, pin 2, pin 3. The stretch is a micro stretch. I'm going to drag the fascia of her adductor muscle towards her knee. This is a micro stretch. All the other stretches you have seen thus far were micro stretches. So there's a pin, there's a pin, there's a pin, and now I stretch using my strength, my weight, and now my chi. And now I balloon head up and float, elongate my spine, and I'm comfortable here. I'm going to breathe. I am watching Christy's face closely for pallor. I saw a little pallor change in there, and I immediately eased off. And it just let go a little bit. Good. Now, part 2 of this move, I move my hand out to about mid-femur shaft and contact her adductor magnus. If there's a pin there, a pin here, and I'm pushing her knee that way, 3 pins, and I drag adductor magnus towards her knee, strength, weight, and chi. I'm watching her face for pallor changes. I ease off a little bit. I float my head up. I elongate my spine. I breathe. I relax, and I'm happy. There we go. Here is the knee stretch. Very important stretch. When the knee is out of place, the peroneus tertius crosses the ankle goes weak, causing instability in the ankle, and the popliteus muscle behind the knee goes weak, causing instability in the knee. When the knee is in place with the knee stretch, these 2 muscles, when weak, miraculously go strong and improve gait. So here we go. There I go. I'm going to hold her ankle just like this. I pull my shoulders back. I stick my chest out. My pin is with my foot pushing towards her head. And then my stretch is I'm just going to lean backwards a little bit and pull the lower leg away from the upper leg. At some point it just lets go. I'm not putting her knee in place here. I'm pulling her knee apart. And then when I let go, it goes back into place. It knows where it needs to be. Here is the hip stretch. When the hip joint, the femur head acetabular cup joint, is out of place, it commonly causes weakness in psoas, that's a hip flexor, pulls the leg up or bends you over, weakness in the rectus femoris, which is also a hip flexor, which bends you over or pulls your leg up, and weakness in the tensor fasciolata. When hip flexors are weak, people's posture commonly is they're leaning backwards a little bit on that side. As a martial artist, I know when somebody's standing like that, you can just come over and give them a little push and they go flying. It's really funny. So that's a sign that the hip flexors are weak when someone's posture is back like that, particularly on one side. Lay face up, please. I'm going to stretch her hip on this side because it's going to be easier for you to see. My contact point is the ischial tuberosity right there. I'm going to come in and put the ball of my foot right on her ischium. Now, I'm bringing her leg to toe my outside, and if it goes under my arm, fine. If not, fine. I'm going to hold her leg. My pin is, I'm pulling her leg as I'm leaning backwards. Shoulders are back. I'm elongating upwards. My stretch is going to be to push her ischium towards her nose. There's my stretch, and I just wait. It takes a while. Ligaments that tie the femur neck to the acetabular cup rim go around the joint 360 all the way around it, and they're very tense strong, so it takes a little while for this to let go. It just let go. There we go. With this posturing here, when treating males, it is important to be careful not to pinch the scrotal sac. People who are scrotal pinchers don't get tipped. Here are the ligaments which tie the femur neck to the acetabular cup rim, including the wide ligament of Bigelow. These ligaments go all the way around the joint completely. They're very intense and very strong. Very important to keep those stretched out. We are now going to perform the postures previously performed on the other side. Christy, could you please move with your head down here for me? Thanks. First is the calf stretch. Remember, cup to heel, brace on the big toe side of the foot, very important. Thumb into tibialis anterior on the outside of the tibia bone in the middle. I'm pulling her lower leg towards her foot. That prevents knee hyperextension. I'm leaning in towards her, dorsiflexing her foot. That's my pin. Now here comes my stretch. I use my strength, my weight, and my chi to super dorsiflex her foot, and I hold and wait for the release. Next comes the calf and hamstring stretch. Very similar. I hold her quadriceps firmly and drag them towards her foot. I dorsiflex her foot towards her nose. I lean in, use my strength, weight, and chi, and flow my energy. And I elongate upwards, and I hold, and I float, and I'm very comfortable. For both postures, I'm supporting her leg on my thigh. The higher up you go, the better the stretch is. Now comes the medial hamstring stretch. I'm holding her heel. I brace the opposite leg close to her body. I'm pushing towards the same side, but out farther, and I'm going to lunge. I'm not going to push like that. That's working too hard. I'm going to brace in my rib cage, or I'm going to come in with a shoulder contact. I'm going to contact with my arms straight. In our case here, for your size mine, I'm going to brace with the elbow. The stretch is partial extension of the lower leg. Here we go, partial extension of the lower leg with a lunge. I elongate upwards and relax and hold and wait for the release. Good. Now for the lateral hamstring stretch on the opposite leg. I'm going to pin the ischial tuberosity. I'm going to brace with a shoulder. I'm going to push your leg firmly into flexion toward the opposite shoulder. That's a pin. Here's a pin of the ischium. Now I lunge and I elongate upwards, and I focus on breathing and staying relaxed and wait for the release. Now comes the IT band stretch. I'm going to brace her foot lightly with my leg. I'm going to use my thumb. If it was a bigger person, I could use my knee. I'm in the middle of her IT band right here. I'm pushing from the top down, pin, stretch, and hold, and wait. I'm going to go several inches toward the knee, pin that thick band, and push down and hold, and wait for the release. Now I come up several inches above, pin the IT band and push toward the floor, elongate upwards and hold and relax. There it goes. Good. I float my head up, I elongate my spine, I breathe, I relax, and I'm happy. Now comes the knee stretch. There I go. Got her ankle, nice firm grip. My chest is forward, my arms are back. I push my foot towards her head, and the stretch now is leaning backwards and hold, wait for the release. I'm going to pin her ischial tuberosity with the ball of my foot, that's a pin. I'm going to have her leg on my outside, or it could be like this if I needed to, but I'm going to go this way because Christy's pretty tall. I'm going to lean backwards, that's my pin. I'm going to push the ball of my foot towards her nose, that's my stretch, and I wait for the release. I wait till it moves a little bit. Takes a little while. I'm elongating upwards and I'm relaxing. There she goes. Good. Now, I have stretched her hamstring both laterally and medially. So now I'm going to do the first strong posterior leg stretch. I come between the legs, not from the outside. Her lower leg is on my outside shoulder. I'm going to internally rotate her leg. I'm going to elongate my spine upwards. I contact the big toe side of her foot. I do a mild dorsiflexion. Here's my pin. Now here's my stretch. I increase dorsiflexion. And I elongate upwards, and I lean into her, and I hold, and I just wait. A whole lot of healing and body work in the assisted stretching is waiting. And now for the second strong posterior leg stretch. Coming between her legs, close to her body, I turn to internally rotate her leg. My right arm's going to straighten out because I'm going to sit down. Ready? Here it goes. There it is. This is my pin. Here comes my stretch. I'm going to elongate my body upwards and bring her leg up with me about an inch at the most. And I hold. And I wait. And I elongate and I balloon head. And I relax. Can you see how doing this style of body work makes the practitioner super sinewy strong? It's awesome. And now, I'm going to stretch the other side with both the first and second strong posterior leg stretches. Rewind and review all of the postures you have learned thus far. Repetition is the mother of retention. These are the sacroiliac joints where the iliums meet the tailbone. The ligaments that hold these bones together are intense and strong. It takes a while for them to release. Christy, I want you to move a little closer to me. Thank you. Little closer. That's good. That's good. Cross the leg over. I'm going to pin this shoulder, and I'm going to just watch her face for pallor changes and be sure there's nothing causing Christy any pain here. She looks fine. That's a warm-up stretch and a way to position her for the sacroiliac ligament stretch. I'm going to brace my elbow on my adductor magnus. I'm not pushing like that. I'm lunging and pushing with my power. I'm going to brace my hand in the middle of her buttocks on the high side into the piriformis muscle. Now, I'm going to hold her rib cage. Not too close to the breasts, not on the belly. I'm on the rib cage. I'm focused on following Christy's breathing. When she inhales, I relax. When she exhales, I stretch her. So here we go. She just breathed in, and now as she exhales, I lunge. She inhales, I let her breathe. She exhales, I lunge and go farther. Now, I'm not pushing in this plane. I'm pushing in that plane. Whenever in yoga the spine is torqued, the spine is also elongated. I shall explain why later. Once again, I brace my elbow on my adductor magnus, put my hand in the middle of Christy's high buttocks. I hold her rib cage, and as she inhales, I let her breathe. She exhales, I lunge, you get a nice stretch. I'm floating up, I'm relaxing. She exhales, I go a little farther. She inhales, I go a little farther. That's about as far as it's going to go. And I wait and I hold and I wait for the release and allow her to breathe. The hand that's on her rib cage isn't pulling, it's just a stabilizing hand. And I wait and it just let go and I moved. Now, occasionally, these bones will articulate and move a little bit and make a cracking sound. When that happens, say, wow, that was a really good stretch. It's in my scope to adjust by thrusting 1, 2, 3, putting it to full tension and set it. That's not in your field unless you are licensed to do so. Yet, to stretch somebody is okay. Things are going to move. There's going to be a little noise. Don't call it an adjustment. Don't call it a crack. Call it a good stretch. Christy, could you please turn with your head to this end? Now, I'm going to do the same stretch to the other side. In practice, I would not have asked Christy to turn. I would have walked to the other side of the table. Christy, move a little closer to me, please. Good. I'm going to cross this leg over. I'm going to see if this is safe for you. I'm not pushing in this plane. I'm elongating you. We're torquing the spine, so we elongate the spine. I'm watching Christy's face for any pallor changes, just watching her eyes to see if the pupils dilate. She seems fine. I brace my elbow on my adductor magnus. Hand goes in the middle of the upper buttocks. I hold her rib cage. I follow her breath. She just exhaled. I lean into her. I'm elongating upwards. I'm very comfortable. She breathes in. I let her breathe. She breathes out. I push a little further. I wait. She breathes in. She has a very relaxed breath. I'm not fighting at all. She exhales. Push a little farther. She breathes in. She exhales, and that's as far as it's going to go. I float upwards. I'm super comfortable here, and I just let Christy breathe, and I wait for it to let go. I'm very focused. I'm very patient. And it just let go, and I moved a little bit. Here is my second most important stretch. This is the costovertebral ligament stretch. This is stretching ligament to tie the ribs to the spine. Ligaments tie bones to bones, tendons tie muscles to bones. The ribs are not fused to the spine, they have movable joints. Got it? So, the ribs don't just go from the back to the front, they go backwards first. There's a little arching backwards where we're going to hook the rib as it arches backwards. We're going to start with our contact in the lamina groove. There's a groove on each side of the very center of the spine. That's the lamina groove, where we're going to contact from the 12th rib all the way up to the first rib. Put this hand under your head, please. So, here's the big switch. I pull her back up off the bed here. I reach a hand under, I let the arm go, and I switch hands. Did you get that switch? I now stabilize her hip in the anterior superior iliac spine. I draw my shoulder in, and I contact the rib at the rib neck, either with 3 fingers shaped just like that, or I can grab several ribs with a hand contact. Commonly, I'll do 1 rib at a time. I pull her rib away from her spine by leaning backwards. That's part 1 of this move. Part 2 is I move towards her head and I elongate her spine and I breathe. I elongate and I wait till it moves a little bit. You just let go. Now, I'm going to go either up her rib cage or down. You can start anywhere you like. I'm going to go down. I've got 1 rib You have to start close to the spine. I pull the rib off the spine. Part one, part two, I lean towards your head and I elongate. I have my knees bracing on the table here. I may not look comfortable. I am comfortable. I'm floating upwards. I'm a balloon head. I wait for the release. You can work all the way up and down, focusing on where it feels tight. As we get up closer to T1, we may have to reach in for the rib contact from the front. Now, if it's a big, heavy person, I may not need to pin the hip. I may just go hand on hand like this and do both hands on the area that I'm wanting to stretch. I would like you to please move with your head down to this end. In practice, I would have walked around the table. For the filming, I'm having Christy move. It's not necessary to have them put the hand under the head. When I'm treating people, I really don't want to be having conversations. I want them to go off to La La Land and just go deep and relax and enjoy the experience. So I'm going to talk to them as little as I possibly can. I'm probably not going to say put the hand under the head, although I may prefer that it's there sometimes. I just take the hand and put it up there, as long as it's out of the way. Here comes the big switch. I pulled her back off the bed, got a hand under her back. I switch hands. I brace her anterior superior iliac spine, the front of her pelvis. I have to reach in and touch on her spine next to the very midline in the lamina groove to pull, to hook that rib. I can grab one rib or several ribs, and I pull by leaning backwards. My knees are touching this table. Part one, part two, I elongate her spine, and I hold and I wait, and it just let go. I'm going to go up a little bit. I'm going to pin the pelvis and pull the ribs away from the spine and elongate the spine and wait. Remember, I can go hand on hand if it's a heavy person. As I get higher up, I may contact her upper ribs by coming from above the shoulder, just like this, and stretch those ribs away from the spine. Same concept. Great. Now, one reason this is one of my most important stretches is this posture miraculously and stunningly corrects moderate to mild spinal curvatures even in people who are older. When doing this work, people may have had a spinal curvature in their spine since they were 13 years old, and they're 45 now, and it's bugged them every day, and all of a sudden it is gone, and they get emotional and say things like, the monkey just got off my back, and they cry and cry and cry. So just realize that this can be an emotional release trigger here. Osteopaths sometimes push a bone the wrong way, and then the body's connective tissue says, no, I don't want to be pushed the wrong way, and it pushes against the osteopath and finds its way back into place. That's called an indirect technique. In my profession, chiropractors, we move bones from point A to point B. That's a direct technique. This is an indirect technique. If her spine has apexed to the right like that, I'm going to contact it on the high side, and I'm going to pull it the wrong way. Yeah, I'm going to make the curvature worse. Here we go. Let's play like you had a spinal curvature with the apex right here. What I do in the evaluation is I take a pin and I draw it where it is, so I would be sure I have the exact right contact. For your information, there are simple scoliosis where the spine is just crooked, out of place, going to the side, and then there's a rotatory scoliosis where it's crooked and torqued. That's the hunchback where the rib cage humps up on one side. That's a rotatory scoliosis. Functional scoliosis respond to this. If the bones have grown that way, if it's an anatomical scoliosis, it's not going to change. It works almost every time, and it still blows my mind. It is just so much fun. People love it, and I regularly host here in this office scoliosis resolution camps where people just come in here through Facebook, and I teach them how to do it, and I help people who have scoliosis in those camps. And we have food. So, with the scoliosis, it's basically the same technique. I pull this arm up, get under here, get here. I'm on the high side of the curve. I'm making the curve worse. I pull it away from the body, and I elongate her spine and elongate myself upwards, and I hold it, and I wait for it to start moving. When it starts moving, basically everybody I teach this goes, oh yeah, I can feel it. It's moving, it's moving, it's moving. You let it win. If you pull too hard, it doesn't work. Keep in mind, the connective tissue is one piece. It's my theory that the connective tissue in her feet and the connective tissue in her neck have all joined into this one thing. The bones didn't just fall out of place. They were pulled out of place by the connective tissue. So I wait, and then all of a sudden it stops moving. I go, oh, okay, it stopped. You wait a little while. It starts moving again sometimes. It's moving, it's moving, it's moving, it's moving, it's moving, and it stops, and I wait until it stops and it stays stopped. And then I stand them up and I check it. Commonly, it is either gone or it is tremendously improved. If it's not gone, I do it again. And if it is better and it's not gone, I switch it around and I go to the other side and do a direct technique, pulling it into place, same technique. I would have you turn, Chrissy, go on and turn for me. Let's say it improved by 75%. I would now come to the other side. I'm not pulling to make the curvature worse. I'm pulling to make the curvature better. Sometimes that finishes it off. Now, occasionally, it's say 85% better. It needs a manipulation. It needs a chiropractic adjustment to finish it off. For people who follow through with the self-treatments, the scoliosis may stay clear lifelong. For people who do not follow through with the self-treatments, the scoliosis tends to come back. If the connective tissue is used to being out, it pulls it again out. For people who feel great for an extended period of time and are doing their self-treatments and then stop doing their treatments, it tends to come back again. This is such an important stretching concept. I figured out how to do this stretch to myself with the connective tissue strap. In my Quick Self Fixes book, I have a chapter on the connective tissue strap procedures A through D. It's such an important chapter that I took it out of that book. Well, it's still in the Quick Self Fixes book. I pulled it out and have a video and book strictly on the connective tissue strap procedures. For people who have scoliosis and choose to be self-reliant, this is a must-have. This is the cervical connective tissue stretch. This is my second most favorite stretch for the neck. Here's the front of the neck. There's the back of the neck. Here's the side of the neck. The nerves come out of little holes, half made by the top bone, half made by the bottom bone. Covering where the nerves come out, there's a thick leather covering which protects the nerves. This stretch stretches that thick leather covering over the nerves. Have your client check their neck range of motion. Turn and turn, lean and lean and lean forward. Do not check leaning backwards, because even in healthy necks, leaning backwards too far can hurt. Commonly, this stretch helps people's neck range of motion immediately, and it helps discomfort in the neck ranges of motion as well. So here's the neck stretch. I fly my hand like a plane under the bridge, and the bridge is Christy's neck. I cradle the base of her skull, the occiput. Can you see my hand there? I turn her nose towards my pinning hand. This hand pins her shoulder down. I elongate her neck, pulling it away from her body, and then I arch it to the side towards me. I'm arching it away from the pinning hand, and I hold and I wait for the release. There it goes. Now, it's very important to turn the nose toward the pinning hand. If this is my pinning hand, I turn my nose toward the pinning hand and I arc my neck away from it. Feels comfortable and good. If on the other hand, if I turn my nose away from the pinning hand and arc away from the pinning hand, I get a very uncomfortable pinch in my upper neck. The bones just don't like going that way. It almost causes a headache. So turn the nose toward the pinning hand. Very important. Christy, if you would, please. Thank you. Here I go. I'm going to go under her neck, cradle her occiput, pin the shoulder, turn the nose toward the pinning hand. I'm elongating and arcing her neck. Elongate and arc. I elongate myself upwards, always focusing on keeping me comfortable. And I focus and I wait for the release. When the release happens, she's going to move a little bit. I'm just waiting patiently. And there it goes. Rest down. Please rewind and review the sacroiliac ligament stretch, the costovertebral ligament stretch, and the cervical connective tissue stretch. This is the hip joint capsule stretch. My wife, Shawn, caused severe arthritis in her acetabular cup femur head joint performing the gymnastics of her youth. She was famous for flying Chinese splits for 4 years. The growth plates in her hip joint were not formed yet, and she caused major damage. Treating her regularly, we have postponed hip joint surgery for years. I can't change the arthritis in the joint. And remember, it's all about making space. I stretch the ligaments that tie the femur to the acetabular cup rim, and that makes space and immediately improves her gait and her comfort. The landmarks are the greater trochanter of the femur and the ischial tuberosity of the ilium. You go between these two to get the stretch of those ligaments. Very important landmarks. For some reason, people end up working in this area. So, here we go with the landmarks. Here is Christy's greater trochanter. Here is Christy's ischium. I'm going to be going between those two. There's a valley there. So I'm going to dig in super, super deep. I'm pushing her gluteus maximus, her gluteus medius, and her deep six and her gluteus minimus over and out of the way, and I'm digging in super deep. This may cause bruising. I say in assisted stretching, do not cause pain. Well, this one hurts. And I tell people, this may cause bruising. Is that okay with you? No one has ever said no, okay? Of course, I say, if it's too much pain, say stop or lighten up. People rarely do, because they want to feel better. So I dig in there with my thumb, just deep, 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 push those muscles out of the way, dig in deep, and then pin, stretch, and hold. And wait for a little giving, a little relaxation under my thumb. I move 1/4 of an inch, dig in super deep, pin, stretch, and hold. Chrissy, are you okay?
I am.
Good. Come off, dig in super, super, super deep, pin, stretch, and hold. I dig in super deep. I relax myself and I float up, pin, stretch, and hold. I'm coming all the way up around that joint with the same concept. Commonly, I'm coming in thumb on thumb, and working like this. Dig in super deep, pin, stretch, and hold, and wait. And then I get into going underneath the tensor fasciae lata to the best that I can, and then over the tensor fasciae lata, pin, stretch, and hold. And pin, stretch, and hold, push in, pin, stretch, and hold. Here's a spot on Christy that's tight. Were I actually treating her, I would spend time here, and I would release this, and when you're done, the tension in the connective tissue goes away, and you can feel that the job got done. I have people stand up and walk around after doing that. They are amazed. It is stunning, the difference a person feels in their hip. It actually temporarily gives them a limp because I've freed up one side. I must absolutely treat both sides or they leave with a limp because I have freed one side. Once again, the hip joint capsule stretch on the other side. Here's Christy's greater trochanter of the femur. Here's Christy's ischium. There's the valley right there. I get in deep into the valley, as deep as I can, and I drag and I hold, I pin, stretch, and hold, and I move 1/4 of an inch. Dig in super deep. I'm not pushing like this. I'm lunging. I'm in thumb on thumb. Super deep. Pin, stretch, and hold. Come off. Move 1/4 of an inch. Dig in thumb on thumb as deep as I can. Pin, stretch, and hold with a lunge. Come off, move 1/4 of an inch, dig in super deep, pin, stretch, and hold, and wait for that feeling of just a little softening under my thumb. All the way around, searching for tight areas, focusing the treatment on the tight areas, ending up going under and then over tensor fasciae lata. So, in practice, I use a wooden tool that's shaped like my thumb. I do it better with my thumb. However, I'm saving my thumbs for my old age. I go back and forth between using my thumbs and using my wooden thumb. This is the hip flexor stretch. This also stretches the thick ligament in front of the hip joint and is an important stretch when treating hip joint dysfunctions. The knee does not like hanging out in space. It can be very uncomfortable. So immediately cradle the knee. There we go, I'm cradled. I'm going to take my hand and push it into her piriformis belly. Now, I must keep her hips stacked perpendicular to the floor. If I do not do that, if she leans too far back, the apex of the stretch goes to the base of her spine at L5 and the sacrum causes pinchiness there. If you feel any pinchiness down here, say stop or lighten up. I'm focusing my stretch to have the apex at the front of her hip joint. This is very important. So first, I cradled her knee. Second, I contact in the middle of her upper buttocks and the belly of the piriformis muscle. I keep her hip joint stacked. I'm arcing her around this way. I'm actually tractioning her femur head away from her acetabular cup. I'm pulling that way. I'm not just pulling straight back. And I'm not pulling in the horizontal plane. I'm pulling diagonally up. So here we go. Cradle the knee. Brace the belly of the piriformis. Pull her leg away from her body. Pulling diagonally up. Pushing forward, keeping her hips stacked perpendicular to the floor. I'm here, I elongate upwards, I'm leaning a little bit on the table with my legs. I'm comfortable, I could hang out here all day. There's the stretch. Now, Christy, please turn and face this way. I cradled her knee, I braced the piriformis belly in the middle of her buttocks on the high side. I pull her leg away from her body. I pull it upwards in the diagonal plane. I keep her hips rolled forward, at least perpendicular to the floor. and I hold. Almost any stretch I'm teaching you can immediately become applied with a proprioceptive neuromuscular facilitation stretch, that's PNF, where I have Christy pull with about 20% of your strength, pull your thigh away from me, and pull, 3, 4, 5, and rest. It goes a little further, look at that, and now pull again, 1, 2, 3, 4, 5, rest. It goes a little further again, and pull again, 1, 2, 3, 4, 5, and rest. PNF is a powerful tool. In my quick self-fixes technology, I apply a whole lot of quick self-fixes from knowledge I've gained stretching people for decades. And I also apply the principles of PNF to self. It gives you a much better stretch. Issue is, I'm making the patient work. People want to come in here, they want to hang out, they want to relax, they want to have an enjoyable experience. They don't want to come here and work for it. Get it? I'm getting paid. They're getting a treatment that feels good. Assisted yoga from Thai massage is commonly referred to as lazy person's yoga, so keep that in mind. PNF was developed by osteopaths, who also developed craniosacral therapy, who also developed positional release, also known as strain counterstrain. Stunning work. In strain counterstrain, let's say Christy had muscles in her buttocks that were very tender and had a killer trigger point. If I can shorten that muscle to the absolute shortest possible position, I can then goat that trigger point out with none or much less pain. You just have to keep fishing for it. So Thai's focus is on stretching. Well, in this case, I'm going to apply my knowledge of stretching to focus on shortening versus stretching. I found a trigger point right here. I'm going to use this same technique to keep fishing around for and searching for where my thumb just sinks in, it goes completely loose, and it's completely soft. I ask, does it hurt now? Does it hurt now? Does it hurt now? And I keep fishing around. It might take some time when you're first figuring out positional release. However, it is a stunning concept for treating people and doing exceptionally deep work that otherwise would really hurt them. This is the lumbar connective tissue stretch. This is my most important stretch of all times. The thoracolumbar sacral aponeurosis is a thick leather covering over your low back. If it was dissected out, you couldn't crawl out of here. Maybe you could roll out of here. It holds everything together. The connective tissue all winds up and ends up in here. This is the hub and those are the spokes. Tightness in this leather covering, according to me, is the #1 cause of chronic low back tension and pain. You loosen this up, you keep it loose. People who have had chronic back pain for 10 or 20 years go, oh my God, the pain is gone. It's absolutely stunning. More stunning than that. When you loosen the connective tissue here, you release it in the entire body. It's a master fix. In my system of quick self-fixes, I have 7 master fixes, 5 of them in my quick self-fixes book. This one is in my quick self-fixes book. So let's say that Christy had a weak biceps muscle. I'm going to push down fake weak, okay? Uh-oh, she's weak. This muscle goes weak sometimes when the biceps tendon is out of place, but could hold. It won't because it might tear. So why don't you do the biceps tendon fix for us, Christy? Christy knows this one. There you go. And then it would miraculously test strong because it's in place. If I was fixing it, I would pin the tendon, externally rotate her arm, and I would set it. Releasing the lumbar fascia makes that strong. How can that possibly happen? It works every time because the connective tissue tree is relaxed and the tension on the biceps tendon is released. So, in the lumbar spine, Christy, face this way for me. Thanks. In the lumbar spine, the vertebrae move back and forth like that. They move in this plane here. When you count up to the 12th rib in the thoracic spine, these vertebrae meet in this plane. If I push straight in on her right here, it's a brick wall, nothing's going to move. I have to push in and up. However, in the lumbar spine, I just push straight in. This is important for this technique. Furthermore, the lumbar facets being in the sagittal plane back and forth, when I torque, I stop here, but if I torque and elongate, I go a lot farther. It's my theory that the lumbar facets are gliding. That's why that happens. I'm pretty sure of it. So very important. The lumbar facets are in the sagittal plane, and the thoracic facets are more in the coronal plane. You have to push up. Thank you, Christy. Here is the lumbar connective tissue stretch. Remember, the lamina grooves are on each side of the very center of the spinal column. I'm contacting the lamina groove on the high side with the thumb-on-thumb contact. I find the spinous process in the direct center and glide into the thumb on the high side. There are 5 lumbar vertebrae, 5, 4, 3, 2, 1. I go to L3, I find the spinous process. I go into the lamina groove of L3 with one thumb. I do a second thumb contact. I push straight in and I hold and I wait for it to release. What I'm stretching here is the ligaments that tie the vertebrae to each other and the discs between the vertebrae and the synovial membranes of the facet joints. Once I feel that release, and I grab the lumbar connective tissue, the fascia, and I pull it that way. I pull it medial to lateral. I'm not pushing with my arms like that. I am lunging, and I hold and I wait for the release. That's L3. I come down to L5 at the base of the spine, just above the tailbone, in the lamina groove, thumb on thumb contact. I push in and I wait until the intervertebral lumbar ligaments let go. It just happened. Now I drag that tissue up toward the ceiling and around, dragging it from the spine up and around, and I wait for the release. And now I find the 12th rib. I follow the spine. That's thoracic 12. I come down one. That's L1. I push in L1 in the lamina groove, thumb on thumb contact, push in, wait till the intervertebral ligaments, discs, and synovial membranes let go. I sink in a little bit. Now I drag that thick leather covering toward the ceiling, medial to lateral, away from the spine, and wait for the release. I've done L3, L5, L1. If I have time, I'll do L4 and L2. Christy, could you please turn with your head to that end for me? There you go. Thanks. Same thing on the other side. I'm in the lamina groove of L3 between the sacrum and the rib cage. I'm in the deep in the groove, thumb on thumb contact. I push straight in, posterior to anterior, and I wait for that release. You can feel it, you'll find it. It's there, it's real. Got the release. I now drag the tissue from medial to lateral, thumbs pulling up toward the sky. Hold, I wait for the release. Same process at L5, go to the base of the spine above the sacrum, in the lamina groove, thumb on thumb contact, deep in, pushing back to front. Wait for the release, and now drag that thick leather from medial to lateral up toward the sky and wait for the release. Going to T12, where the 12th rib is, finding L1, going thumb on thumb in the lamina groove, thumb on thumb, push in, wait for the release. All the while, I am floating up. I am being a balloon head. That is a way of life for me. Now I drag the connective tissue away from the spine, up toward the sky, medial to lateral, and hold and wait for the release. And again, if there's time after doing L3, L5, L1, I'll do L4 and L2. So here, when there is a scoliosis in the lumbar spine, and buddy, there, I'm going to contact on the high side of the curvature. I'm going to pull it to make the curvature worse. Keep in mind, there are simple scoliosis, this is where it just leans to the side. Rotatory scoliosis are complex, they lean to the side and they rotate. These vertebrae get bigger and bigger and bigger to bear weight. If I can get the curvature out, but not the rotation, I'm pretty darn happy with that, because the weight-bearing load has shifted to the vertebral bodies in front. With a scoliosis, the person's eyeballs are over their symphysis pubis, but they're having to work so much harder to stand up with the eyeballs balanced over the pelvis. By the end of their day, they're sometimes wasted. So getting the spine straight, whoa, they are so grateful. So with a scoliosis, let's say that the apex is like that. Apex is going to her left. I come to the high side of the apex. I pin thumb on thumb, and I pull that way, making the curvature worse. I hold. If I'm holding too hard, it is not going to work. You got to focus here. You got to feel it. You're going to feel it. It's going to start tugging, pulling to straighten itself out. It is as though every potential piece of her tissue that can chip in here and pull gets on it. And within a matter of minutes, it pulls the scoliosis right out and straightens it up. Keep in mind, it may pull. It's pulling. It stops. It got tired. It needs to rest a minute. It starts pulling again. Pull. You're going to go, wow, I can feel it moving. It's going to keep pull. It may stop. And eventually it's just going to stop and stay stopped. You stand them up and recheck them. Lean your head forward. I go like this, turn on her spine to push in the lamina grooves deep. I'm checking. There's a curvature. You're going to feel it's going to go hard to one side and then back. It's coming down straight. Lean forward, please. Straight, lean more. I sometimes brace them there, all the way, lean over, all the way down. That's how it's checked. Pushing in the lamina groove super deep so that you can feel where it is. And I mean, when I teach this course, and let's say I have 15 people in the class, 3 or 4 are going to have a significant scoliosis. It is a health concern that is rampant. This is the thoracic connective tissue stretch. Remember, in the lumbar connective tissue stretch, I'm pushing back to front. The vertebrae meet in those plane lines. When I get the 12th rib and follow to thoracic vertebrae 12, it moves in this plane. So if I push straight in, nothing's going to move. It's a brick wall. I have to push in and then up towards her head. Henceforth, when I'm pushing on the lumbar spine, I'm facing straight in. When I push to the thoracic spine, I'm pushing in and towards her head. So here we go. I'm not pushing with my arms, I'm lunging. Find the 12th rib, follow it to T12, thoracic vertebrae 12. I'm in the lamina groove on the high side, thumb on thumb contact. I push back to front and foot to head, and I wait for it to melt. I move up a vertebrae, I push back to front, posterior to anterior, and inferior to superior, and I hold. I move up a vertebrae, I push back to front, I push foot to head, and I hold, and work all the way up the spine. Now, on some people that are really big people, I use my pisiform. The pisiform is that little hard bone in your hand right there. It's a really big person. I'll choose a pisiform contact, and I brace with the other hand so that when I push in and up, the hand doesn't slide. As a chiropractor, this is commonly the bone that I use when I adjust the spine, so naturally I go to my pisiform. I work all the way up. Now, as I get closer to her head and I'm pushing in, it may fold her over and compress her heart and lungs. That's not good. So I'll comment if they start folding over. I'll hold the shoulder and go with one thumb, push back to front, posterior to anterior, and inferior to superior, foot to head, and I work all the way up to the very top vertebrae. That's that. Christy, please turn to the other side. I find the 12th rib, and I follow it into the spine, thoracic vertebrae 12. I go thumb on thumb contact in the lamina groove on the high side. I push posterior to anterior, inferior to superior, and I hold and wait for the release. I go to the next vertebrae, thumb on thumb contact in the lamina groove, push posterior to anterior, back to front, inferior to superior, foot to head, and I hold and I wait. And I work my way all the way up. Remember, you can use a pisiform contact in there. As I'm getting closer to her neck, I hold her shoulder back where she doesn't cave in on her heart and lungs, and I work all the way up to the very top of her thoracic spine, which is at the base of her neck, pushing back to front and inferior to superior, and that's that. This is the upper cervical connective tissue stretch. It's similar to the lumbar connective tissue stretch in that it is a master fix and at least temporarily makes all chronically weak muscles instantly strong by making space. This technique emulates a chiropractic technique called HIO, hole-in-one. The chiropractor has the patient lay on the side with the headpiece that drops and adjust the top bone in the skull, the atlas. That's all they do. They claim that it is a panacea and takes care of everything. My opinion, it is not a panacea. Yet, if I could only do one chiropractic technique of all the ones I know, I would do HIO, hole-in-one. So, here we go. My hand goes under her neck. My middle finger goes below her ear between the base of her skull, the occiput, and atlas, the top bone of the spine. I'm stretching a thick leather aponeurosis covering between her skull and the top bone in her spine. My head lightly touches her. My hand lightly touches her head. Skulls don't like being compressed heavily. I begin by tractioning her spine, pulling towards me by leaning backwards. That's very important. Traction is important here. And as I rock back and forth, I gently but sturdily drag my finger from behind her ear toward the base of her skull in the midline and back. Takes a little while. I now switch sides. Index finger below the ear between the base of the skull and atlas, the top bone of the spine, and I gently traction the spine, the skull towards me, and rock the head back and forth as I pull my finger toward the midline of her skull and back. I commonly do this 3 times. Can you see my contact there with the middle finger below the ear? I'm digging in deep between the skull and the atlas. I'm tractioning her spine by leaning backwards, and I'm slowly gliding to drag and stretch that thick leather covering between her skull and her upper neck. Should feel really good. Dig in super deep. I'm rocking back and forth. I'm tractioning her head, pulling her head towards me by leaning backwards. I'm elongating upwards. This is the cranial alignment phase. In yoga, at the end of yoga class, there's a posture called Shavasana. And Shavasana is where we all lay down and take a short nap together on the floor. Yoga loosens everything up and makes a whole lot of space and gets the fluids moving, and we need a moment to integrate it. One would never take a yoga class and skip the Shavasana phase. I've never seen anybody skip that phase. It's very important. This is my version of Shavasana following an assisted yoga stretching session. So it's all gentle. I'm going to cradle her occiput with my fingers, and I'm going to touch the greater wings of sphenoid, which are her temple. It's a very light touch. If you push too hard, it doesn't work. I learned this from my wife. She said that her teacher, Jim Jellis, said that his teacher, Ann Wells, said that it's like you're wearing a jetpack and you're flying along and you see a beautiful horse galloping in a field, and you land on the horse and you slowly turn off the jetpack in a way that the horse doesn't even notice that you have landed on it. You have joined the horse's rhythm. Keep in mind the cranium is moving, the frontal bone's going this way, the occipit's going that way, the parietal bones are going this way, the sphenoid is flying. There's a lot going on, and if you just clamp in on it, it's not going to happen. Play with it for a little while. Some people get it instantly, and some people it takes time. It took me some time. So here, cradle in the occiput, I'm lightly touching the greater wings of sphenoid at the temple, very light touch. And I imagine that the skull is a water balloon with changing hydrostatic pressures. I follow them. Do you remember me talking about indirect technique? You push the scoliosis the wrong way, it pushes against you. Well, I'm kind of pushing on her skull and fishing around for, is it going to push against me? Or, at the same time, I'm pushing on the skull, seeing if it wants me to push on it and if it's going to move a little bit. It's all very subtle. It's really there. I promise you it is, and people absolutely love this. So I'm holding her head. The body through our session has been relaxed. We've made a lot of space, and the cranium hasn't caught up with it. The cranium is a microcosm for the body. It wants to align with the body's new relaxation. It wants this. So here goes. I'm holding Christy's head here, and I'm not staring straight at her. Little dogs and children don't like being stared directly at. Our innate doesn't like being stared directly at. I'm looking at her peripherally. It's not about me looking at her innate, it's about her innate looking at me to see if I'm worthy to come into me and use my hands. Her innate and my innate are very old and know each other well. If I get super quiet and super still, I just follow it. I'm not really doing it, I'm following, I'm being used. Yet I'm still palpating and following. So it can go to the right and go to the left. One side can go clockwise, the other side can go counterclockwise. It just happens. There's a whole lot of motion in there. And if you just play with it for a while, keep an open mind, it's going to come to you. At some point, the cranium makes it, and it reaches a still point. Biodynamic osteopaths state that there are 4 levels of stillness. How I define that in my system, which is different than theirs, the first system is her cranium just got still. Boom. Next, I imagine that her body becomes weightless and floats up, and I'm palpating her entire connective tissue tree from her toes and fingers all the way up, as though I can feel the wholeness at the same time. And I may just lightly traction her. You can feel that tug in the system where there's a little tension in her low back on the left, and I push against it, and it starts pushing against me again in direct technique, and I'm just kind of pushing into her connective tissue system, making it a little worse. And then it pushes against me and it lets go, and then I just get quiet and still, and I feel in her middle back there's a little area that just there's no movement there, and I just kind of traction and push into it and wiggle with it and push on it until it starts pushing back on me, and that unwinds. And I keep doing this until the body goes still. Now her cranium and body have aligned into stillness. At this point of stillness, to the next level of stillness, energy starts to move. Energy doesn't move well in a system that is contorted and tight. When we get to the still point of body and cranium, this thing just happens where there's a lot of energy moving around, and then that slows down and stops, and then comes the 4th level, which is a deeper stillness. We think we're still, we go deeper into the ocean, deep down to where there's no movement, stillness, or into the outer reaches of outer space where things are perfectly quiet and still. It's just deeper stillness, and hang out there. At this point, it is as though my hands are glued to her head and they don't want to let go. And I go, okay, I'll hang out here with you. And I wait. And I touch even lighter, 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 because she has reached that fourth level of stillness. And eventually, my fingers become unglued and I can let go. Takes me about 3 to 5 minutes. I have a relatively short attention span. My wife, Sean Murray, can sit there for an hour and a half and hold your head. It's amazing what the woman can do. I don't have and don't want to have the patience for that, so I shortened it. I enjoy doing it. People enjoy it, and I ask people for feedback, and you'll be surprised at the feedback that people give you about what their experience was. It may have only been 3 to 5 minutes, yet for them, it's a timeless experience. Also, as a body worker doing very physical body work, it's nice to get paid to just sit here and hold someone's head and experience love and light. At this point, I'm going to want to bring Christy back to planet Earth. And I come down here and I say hello to her feet. You can do any of your loving foot techniques that you would do with a friend just to wake them up, whatever it is that you're going to do. And Christy wakes up now. And I ask her, how was that, Christy?
That's great.
Okay, good. Thank you. Here is the seated thoracic connective tissue stretch. Following the cranial alignment phase, it's important to bring one back to the world of driving cars. So Christy is sitting up and she is now proprioceptively responsible for her body and space, and it's bringing her back to the awake state. I'm going to put this hand right there, put the other hand right here. I'm in the lamina groove anywhere I choose in the lower to mid to upper thoracic spine, and I push in from back to front, and I push from inferior to superior, down to up. Once I have that, I elongate Christy up by pulling her up a little bit with her arm, and I torque her by pulling her arm and pushing with my thumb, and I hold, and I wait. And I get a little relaxation. I choose some other spot, either farther down or farther up. I push in, posterior to anterior, back to front. I push floor to sky, inferior to superior, and I elongate her up, pulling her arm up, bringing her up with me. As I elongate myself up, doing balloon head, it brings her up with me, and I turn and I hold. I'm going to do one more spot. You can go up pretty high in the spine. I push back to front, floor to sky. I elongate myself up, that brings her up, and I torque, and I hold. And now rest. We're going to switch hands. So, on the other side, I'm going to do the same thing. I'm keeping her as though she was a record on a record player with a still pole going through her middle. I don't want her leaning backwards or to the front or to the side. I'm keeping her spine exactly vertical. That's important. I push my thumb in the lamina groove on the right. I reach around to the high side. I'm pushing in on the high side. The high arm is the high side. I push back to front, floor to sky. I torque her and I elongate her upwards as I balloon head myself up, and I hold. This can be a PNF stretch here. Also, I commonly do this with people when I'm treating thoracic area discomfort, pain, and tension. I push back to front, floor to sky. I torque her, I elongate her upwards. Now I ask her to push against me to untorque yourself with about 20% of your strength, and push for the count of 5, 4, 5, and relax. She goes a little farther. I move up to another level. I push in the lamina groove on the right side, high arm on the right side, back to front, floor to sky. I elongate myself upwards. I get traction her spine upwards, and now I ask her to gently unwind herself, pushing against me, 20% of your strength. 5, and rest. It goes a little farther. And rest. Here is the seated shoulder stretch. This stretch emulates a clavicle adjustment, chiropractic extremity adjustment, And a shoulder adjustment, another chiropractic extremity adjustment. This stretch makes strong the middle trapezius muscles, pectoralis major, pectoralis minor, and the rotator cuff muscles, including infraspinatus, supraspinatus, teres minor, and subscapularis. Put your hand behind your head. I'm coming through the eye of the needle here. I'm pushing my elbow into her upper back next to her spine. I'm gripping, and I'm pulling her arm backwards towards me, and now I'm pulling it up as I balloon head myself up. I bring her with me. If I'm just trying to bring her up, that stresses my back. Yet, if I have her kind of glued to me and I just bring her up, that works. I wait for the release. It's an awesome stretch for the shoulder joint. Switch sides, please. So, I go through the eye of the needle and I grip her here or here. I push my elbow into her upper back. I need to stabilize her other side with this knee. Commonly it's not necessary, but sometimes people need the extra support. I'm going to pull backwards towards me, and I'm going to elongate myself up as I balloon head and traction my spine upward. I bring her up with me, and I wait and I hold. When it releases, there's a little movement. There we go. And this concludes assisted stretching postures from Thai Massage on the table. Thank you for joining me. At the end of your book, you will find a chart, an appendix, correlating the stretch postures with which muscles they make strong and which quick cell fixes also make the same muscle strong. You have studied all of the postures. Here's where we put it together in a routine. I'll be moving along at a pretty fast clip, not the speed that you would be doing a normal session. In a normal session, you're waiting for each posture to relax. I'm doing this so that you can get it down into rote memory. Remember, repetition is the mother of retention. I start sessions with happy feet. In 2012, I studied the feet all year long. Each year I study something exclusively for that year. And happy feet, it takes my knowledge of stretching connective tissue and applies it to stretching every ligament in the feet. It takes about 2 minutes per foot. Once done, people proclaim that it feels like it's the first time that they notice that they even had a foot, and that the other foot feels like a numb wooden peg leg. Please consider studying happy feet with me in the future. I'm also working on happy hands this year, and it's looking pretty exciting, particularly for body workers, musicians, and computer people. So here we go for the routine.